Good evening and welcome to an all-new episode of Hala Kuwait. I'm your host Rita Abdo, and for today's live episode our team has lined up various interview segments and several reports on different topics for your viewing. In the beginning of our show, I would like to remind you to keep taking precautions against COVID-19 by wearing medical masks and of course social distancing to ensure a safe and healthy society. Dear viewers, our first report is on the opening of the World Health Organization official office here in Kuwait. Let's view this report and we will be right back.
At the state of Kuwait was inaugurated at the UN headquarters in Mishrif area in the presence of the Minister of Foreign Affairs, Sheikh Dr. Ahmed Nasser Al-Mohammed, and the Minister of Health, Sheikh Dr. Basil Ahmoud Al-Sabah. This opening ceremony will provide and develop health plans and health care, especially in these circumstances, exceptional circumstances that the whole world is faced due to the outbreak of the COVID-19 pandemic, and also for the important role that the WHO play in this crisis. To talk in this regards and to talk about this opening with us, the WHO representative at the state of Kuwait, Dr. Assad Hafeez. Good afternoon, Doctor, and in the beginning, let's say congrats for the opening, and I wish you all the best. Dr. Assad, let's know in the beginning that about the support from the state of Kuwait for the WHO.
Good afternoon, and thank you very much. And as you mentioned, it's a very important day today on the inauguration of WHO country office in the state of Kuwait. The state of Kuwait has been a member of World Health Organization since 1960. So this partnership has been going on for decades. Kuwait has been a very active contributor to the activities and resources of World Health Organization, and this particularly increased since the onset of pandemic. So the state of Kuwait has contributed more than $60 million in last couple of years to tackle the global emergency through WHO, and it has also contributed to COVAX, which is the global organization which is looking after the COVID vaccines. So this has been very prominent, and very recently the Director General of WHO also thanked the government of Kuwait and its dignitaries on this huge contribution. So I'm sure that with the opening of a WHO office within the country, this contribution and this partnership would further grow.
So what about how does the WHO support Kuwait in the health promotion?
As I mentioned, this partnership is not new. It's been there for quite some time. But with the in-house presence of a resident WHO coordinator within the country, as well as the office in the country, the avenues for collaboration with the government would increase many folds. WHO is a member state organization, and the purpose of the work of WHO is to involve the member states in their work as much as possible, and provide them the technical assistance and other resources from anywhere in the world. The best possible practices are provided through the country office, through the regional office, as well as through the global headquarters. So we intend to work together and further strengthen the collaboration on pandemic response, the surveillance systems, the laboratory systems, similarly the strengthening of the health systems through the three levels of care, that is primary care, secondary care, and tertiary care systems. Kuwait already has a good family practice system, and we would strive to ensure that the best practices which are being carried out in Kuwait are also exported to other regional countries. So we see together with the government Kuwait as providing the required leadership within the region and globally with its best practices both in implementation and in research of health sector.
Thank you, Dr. Assad Hafeez, the WHO representative at the State of Kuwait, for being with us. Wish you all the best.
Dear viewers, the inauguration of the World Health Organization's country office in Kuwait happened at a perfect time as the world is facing exceptional challenges due to COVID-19. We have been joined by WHO's representative in Kuwait, Dr. Assad Hafeez, who will be talking to us about the opening and what exactly went on yesterday. Good evening, Doctor.
Good evening.
It's a pleasure to have you with us on Hala Kuwait today. We're going to be talking about the opening and, of course, congratulations on that.
Thank you very much. It's a pleasure for me to be here as well.
Thank you. So in the beginning, can you tell us about the inauguration of the WHO office in Kuwait that took place yesterday? How was it?
The World Health Organization office was inaugurated on 15th of June, that is yesterday. It was a very long planned inauguration, which got a little bit delayed because of the COVID pandemic. As you know, there are multiple challenges and logistics on that.
Yes.
But Alhamdulillah, yesterday it was carried out in a very befitting manner. We had the Honorable Excellency Minister of Health as gracing the occasion as chief guest. We also had Deputy Foreign Minister of Kuwait also present in the ceremony. Then we had the resident coordinator of UN with us, and virtually we had the Director General of WHO joining us from Geneva, and the Regional Director of WHO joining us from Cairo.
Perfect.
So they were like, because of the COVID situation, the physical attendance was limited to 15 persons.
Yes.
And we tried to observe all the required precautions, that is the distancing, the masks, and all those things which needed to be there.
Right.
So it was a very graceful and a very short but very meaningful ceremony, which concluded in time yesterday morning.
So unfortunately it was not as big or as long duration-wise as you would have liked it to be, but do you think it was successfully held in terms of precautions due to COVID-19?
Absolutely. Because of, you said rightly, I mean, we would have liked it to be much bigger.
Yes.
But then we also had all the UN community, all the ambassadors, the staff from the Ministry of Health, and other regional dignitaries from WHO joining us virtually. So though we were there only 15, but it was a much bigger audience from not only from Kuwait but around the world.
Yes, there's so many disadvantages to COVID-19, but I think the one advantage is that now we can attend any event anywhere in the world through an online meeting, so that's great. So Doctor, what do you think the aim of inaugurating the office in Kuwait is? How do you see it benefiting the people in Kuwait?
Well, World Health Organization works globally, and it has 3 tiers of functioning. There's a global tier, which is based in Geneva. Then the whole world is divided into 6 regions, and there's the regional tier, which for us, Eastern Mediterranean region, is based in Cairo. The last but the most important component is the country office. So those are the feet or the boots on the ground.
Yes.
So though the global and regional offices do provide a support, but to contextualize that support and that assistance into country context is the job of the country office. So though WHO has been working from a very long time with Kuwait, but this component has been missing. And we are very grateful to the government of Kuwait and the WHO administration that despite the challenges of COVID pandemic, this program was completed, and we were able to put in an office in Kuwait, in specifically in this difficult time when it is needed the most.
Right.
With the consequences and with the challenges, not only Kuwait but the whole of the world is facing because of COVID-19. So I'm sure with these this office in place and with those linkages developed with the local stakeholders,
yes,
it would bring out much better results in times to come, which are according to the expectations of the government, of the UN agencies, of the stakeholders, academia, civil society, and most of all the public.
Hopefully.
So we would be able to work more closely with the communities and adjust our work according to the requirement of the local communities.
Of course, hopefully with your help, we'll be done with COVID-19 sooner. It came at a perfect time, as you did say, the opening of this office. So, Doctor, how do you think this inauguration will be a milestone or a continuation of this milestone of the long-standing partnership between WHO and Kuwait?
Well, we know that Kuwait joined WHO as a member state in 1960.
Yes.
So since then, there has been a very long-standing partnership between Kuwait and the World Health Organization, which has been strengthening over the time. There have been multiple projects, both inside Kuwait, and Kuwait has been helping World Health Organization in projects outside Kuwait as well, particularly the conflict-affected regions, countries in the region, as well as those which are affected by natural disasters. So this has been going on. For example, we have a WHO collaborating center in Kuwait working since 2016, which has been providing all the required capacity building to the regional countries. But since last 1 or 2 years, this collaboration increased much more. And then it was realized by the current government, His Excellency the Minister, that we need to have an in-country office.
Definitely, if this partnership has been going on for all these years, an office fits right in place as a milestone. So, Doctor, since you're working really closely as WHO with Kuwait and the Health Ministry here, did you feel like Kuwait contributed effectively in response to this pandemic?
Again, it's very important for all of us to know that Kuwait is one of the largest donor country for WHO, specifically for COVID response. So in early 2020, last year, a significant amount of resources were given to the World Health Organization, and these resources were used specifically for those communities which are poor and marginalized and have been worst affected.
Right.
So Kuwait has really the aid and the resources given by Kuwait have gone to the right place, and they have really helped fight the pandemic at the global level.
Of course, we might think that we're having a bad time maybe in Kuwait, but compared to other places, we are in really good hands right now and everything is going well. So, Doctor, finally, do you think that with this new office, will Kuwait be able to reach the 17 sustainable development goals that are set with the United Nations, we can say in an easier or even a faster manner since the opening of this office?
Primarily, health is in SDG 3, but now we have started realizing for now pretty some time that many factors which are outside the health sector actually affect the health of the people. So a multi-sectoral collaboration is required, and other sectors other than health like education, environment, climate, industries, infrastructure, and so many of these diverse sectors need to be taken together. And we need to have health in all policies to ensure that finally the best possible product is delivered and the populations are healthy. So I'm sure with this office and with our ability to work more closely with local institutions, we would be able to contribute more effectively to health of Kuwaiti people.
Of course, like that, the efforts will be put in the right place, and hopefully you'll get to these 17 Sustainable Development Goals as soon as possible. Of course, Doctor, here on our part, the media is always reminding of precautions and how to stay safe and to ensure a safe and healthy society, really. But since you're the World Health Organization's representative here, can you just give us some advice or precautions from COVID-19?
Yeah, I will, at the risk of repetition, I would repeat 4 things: masks, distancing, sanitation and hand washing, and get yourself vaccinated as early as possible. If we observe these few things, I'm sure Kuwait would be very, very soon free of this pandemic.
Hopefully, of course, we agree with you on that, and we've been reminding everyone to take the vaccine as soon as possible. Thank you so much for all the information you gave us today.
Thank you, my pleasure.
Thank you. Dear viewers, we had with us WHO's representative in Kuwait, Dr. Assad Hafeez, and now we're going to be viewing a report on patients helping to fund a society campaign under the